There are different factors that can affect the pelvic floor. So obviously pregnancy itself, hormones can affect the pelvic floor. We've talked about that it's made up of different things such as muscle or connective tissue, and hormones in pregnancy affect all of our connective tissue, allowing it to stretch and move so that baby can grow. The weight of baby and our abdominal organs can actually put more stress on the pelvic floor. And labour itself, even having a C-section, can affect the health of the pelvic floor. And I know many a woman who has done lots of exercising of their pelvic floor during pregnancy, but still may experience some dysfunction or trauma to the pelvic floor, depending if they've had an episiotomy, if there's been a tear, if they've had to do lots of bearing down. The pelvic floor health after pregnancy has been shown to take 4 to 6 months for a muscle called levator ani to start to recover, and then for some people even up to 12 months. Depending on what has happened, simple pelvic floor exercises can be enough, but there are some women who do need a bit more support, and that's when a women's health physio is exceptionally important, and they may need some more guidance or something like a pessary if they have a prolapse. The other factors that can affect our pelvic floor health outside of pregnancy are kind of multifold. Like anything in life, there's so many things that can affect us. So simple things, so smoking can affect our muscles and how healthy they are. Our diet, especially for our bladder and our bowel, if we're having lots of caffeine or sugary drinks, that's going to affect our bladder health, and that's going to affect our pelvic floor. Our bowel, if we are very constipated, that's going to mean that there's a lot of bearing down, there's a lot of pushing, and that again can have a weakness in the pelvic floor. How flexible we are in our body, and that comes down to the function of the pelvic floor as we breathe. If we have enough flexibility in our spine to breathe well, then our pelvic floor is going to have a chance to be a little bit healthier. The sport that we do, so the main sport that can really affect pelvic floor health is trampolining. So all those Olympic gymnasts with all that bouncing definitely have some weakness in their pelvic floor. And then if you do have pelvic floor weakness, avoiding sports such as squatting and lunging and even really aggressive sit-ups can put too much pressure on the pelvic floor. It creates that bearing down. Other things slightly less outside your control at the moment are sleep. So sleep affects how our body functions. Our hormones affect our pelvic floor health as well. So all these different flavors show that our body is much more complex, and the more that we can be aware of that and make any changes that we can, the more likely it is that we will have a healthy system. Or even if something happens outside of our control, like trauma to an area, if everything else is checked off and is a little bit better, we may, not in all cases, we may stand a bit more of a chance of making a better recovery. I'm very aware that there are women who really do look after themselves, but have had some significant problems with their pelvic floor after labour or during pregnancy, and it's obviously more complex in those situations. So from that and understanding our function and all those roles, we then have an ability to strengthen, we have an ability to look at our breathing and put that all together to give you a chance of increasing and improving your pelvic floor strength.